We're taking you through our top 5 anti-aging treatments.
This is something new.
Has very few complications.
The Karen down the road sees anti-aging or aesthetic medicine as very vain.
Microneedling is back on for 2025.
And it's so creamy.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
We're taking you through our top 5 anti-aging treatments. So we get asked this a lot. What are the things that we're doing and what are the top things that we recommend? So we figured let's have a fun episode. We're going to go through our top 5 of the must-have things that you can do for an anti-aging treatment.
Perfect. You want me to go first?
How do you want to do it? You want to spout out your 5 or
we could
you
do that.
Just talk 1 through? Yeah, let's hear what your 5 are because I don't even think I know.
Okay, my top my top 5, and I coupled these two in together, are SPF and retinoids, so maybe I cheated.
So skincare?
Skincare. SPF and retinoids specifically, that's my, in no particular order, but okay. I guess I could rank that number 1. Then I have Botox, Sculptra, or some form of filler, and I can get into why I said that specifically. Mm-hmm. Maybe I cheated. CO2 laser and microneedling.
Have like 7. Okay, I followed the rules. I have 5. Botox, microneedling, BBL, retinoid, SPF.
I knew you were going to pick BBL.
It's my new favorite.
Okay, well, we both agree on Botox, microneedling, retinoids, and SPF.
Wow. We're basically the same. Who would have thought? Okay, Botox. Let's kick it off with that one because it's my number 1.
If you ranked it, that would be your number 1 anti-aging.
Yes.
This is something new.
I love it. And if you can't tell, I just got it done. Okay, Botox. Because it is going to work almost immediately. It is quick. It's effective. It has a little downtime. Has very few complications. And if there are some, they go away on their own. You go back to completely like you were before you started. And that's why it's my favorite.
Yeah, completely agree. I mean, also, aside from all of that, which are amazing benefits, you get a preventative benefit from it too. I mean, you see, like, think for a second, like, think about your grandma, your mom, anyone you know who doesn't get injectables. They have deep lines here. They have some lines here. Maybe they have some deep lines here. So even if you don't necessarily want it for, let's say, like, cosmetic reasons, like maybe you don't even necessarily care about your brows being arched,
lifted, yeah.
But you do care about aging just a little bit gracefully. You could get Botox twice a year and look 10 times better, 100 times better than your counterparts who aren't getting anything done.
Yeah, it's my number 1. Right. I think I do the most of it as far as like my patient population goes. I do full face, like tox all day long. And by that, I mean, at least the whole upper face, a lot of lower face as well. And it's a really just like treat yourself moment. And I think that a big question that I get asked a lot is how to budget for it and like what that budget looks like. And it can look very different. It can look like baby Botox and maybe you're in your 20s and you're not having to get as much and you're only getting it twice a year and you can spend $400 or $500. Or you can go all out and maybe if you're more mature and we're really trying to treat the whole face, you're in that $1,000 range. But still, I treat my patients to full correction. So does Megan. I can get 4 good months in most of my patients. Some at the 3-month mark, but so 3 times a year, that's how you budget for that.
Yeah.
It's a home run.
Yeah, I think that's great.
All right, next.
What's our next one? So why don't we...
microneedling.
Yeah.
We both agree on that.
Yes, we do. Microneedling is fantastic. It's so underrated. It
I
stimulates...
feel like it's come back to us.
I agree. And I think that's because of PDGF. I will say that I do feel like I've done a lot more research. I mean, we know the benefits. The benefits are there. They're amazing. There's very little downtime. There's there's very little risk, but I think like the surgence of PDGF and how phenomenal your results can be coupling these.
Yeah.
I think it's just made me like want to dive into it again.
Yes, and I think it's well studied. The data, the literature there is just phenomenal in dermatology. That's where it all kind of started. And then we know it increases collagen. One treatment alone replaces all your collagen for a year. Four
Like
treatments.
what, 300 by 300%, right? 400%?
4 treatments will increase by 400%.
Gotcha.
But one treatment replaces all of your collagen lost in a year.
That's crazy.
So you are getting such amazing benefits, and for a very low price point when it comes to aesthetic medicine.
When you think about what it's doing and the amount of collagen you're getting and what it can treat fine lines and wrinkles, scars, some pigment, enlarged pores, overall skin rejuvenation.
Yes.
That, I mean, for what, $350
Yes, even
a
basic
treatment?
microneedling.
Yeah.
Now we have advanced microneedling where we can do PDGF, we can do PDRN, which is our salmon DNA. You can couple it with Botox. You can couple it with PRP. You can do it with Sculptra. There's so many like advancements. So you're getting even better results, but hands down, it's making a comeback.
Yeah, I agree. It's awesome. And I kind of do, like, I highly encourage my patients to couple it with all of those.
To do some advanced treatments.
Yep.
You can get good benefits doing basic, but we really are seeing a lot better outcomes. I had a patient text me today. She did a little stack treatment. She's like, I got so many compliments on my skin.
What did you guys do?
We did a Moxie microneedling with PDGF.
Oh, nice. Oh,
Yeah.
that was that one patient
Yeah.
that you did on. Moxie, then you did, Kaylee did the microneedling, and then
esthetician.
you microneedled with PDGF. That's fabulous.
Yes, so microneedling is back on for 2025.
So what else? Okay, we both agreed on the SPF and retinoids. I just coupled mine.
I know. Okay, favorite SPF, go.
I mean, I
Say the answer.
I love my Color Science Flex because of the filter it puts on my skin.
Coverage is good.
It's amazing. But I have been grabbing my barefaced tinted
Okay,
a
I
lot
didn't know
lately.
if you liked it at one point. Because of the coverage, though, probably.
Oh, the coverage for me isn't there. That's just, I think I just have a different shade to my skin.
About it, though, it like, you feel a tightening effect
It's
happen.
it's so creamy. It's so hydrating.
I've been really impressed with it because maybe I don't use a lot of products with caffeine in them, but when you put it on your skin, you can feel it tighten your skin. That sounds woo-woo, I think.
I don't necessarily feel that. I think you're having a placebo effect.
No, I swear, you can feel it tighten up.
Well, what's your
to it
favorite?
next time.
Why'd you ask me my favorite sunscreen?
Because I just wanted to know.
Oh, you just want to know? Well, what's your favorite for the followers, even though I already know the answer?
Tone Smart.
Yeah.
SPF. And
Okay,
then
but
followed by Revision in Teleshade.
Okay, dang it.
Then followed by Barefaced.
Well, what about Pavise?
Oh, yes.
That is amazing for anti-aging and sunscreen and like so many other things all in one.
It's great. I know that if you want tinted, it's not tinted.
Well, yeah.
I love it for my husband because he doesn't want to do any products.
Yeah.
It doesn't smell like sunscreen, doesn't feel like sunscreen, and you're getting so many benefits. If you're a minimalist at heart, Pavise, hands down. One product a day, you could get away with it.
You really can. 80 to 90% of our visible aging comes from the sun. So that's why sunscreen will always be probably number one of my, anti-aging treatments. Second to that is retinoids. If you haven't listened to the episode before this, we just talked about retinoids. We did a deep dive on those, why they're so important for skin health and anti-aging.
So go back and listen to that because we spent a fair amount of time getting into all the weeds of retinoids, but they are amazing for anti-aging. Sun, collagen production, speeding up skin cell turnover, making your products work better. Your lasers are going to work better. Your microneedling works better. Everything works better if your skin is functioning properly.
We love it. It's also great for acne. So if you have acne. Okay, so I think what we differed in.
Take yours away. Yeah, take that. Yours is not take it away. I meant take it away.
Oh, take it away. The next one. I was like,
No.
what we differed in, and I'm
Yes.
surprised, but I knew you were going to pick BBL, and I love BBL, but for my anti-aging, I'm picking CO2 laser, and you're picking
did you
BBL.
put that in there?
I did.
Oh, I didn't hear you say that. So technically you had like 8 then.
I did not.
Okay.
I had SPF and retinoids, Botox, Sculptra,
and HA filler.
CO2 laser, microneedling.
That was a lot. Okay, BBL. Let me tell you why.
Okay.
Because we all know that pigment makes you look older.
Mm-hmm.
BBL's main target is pigment, redness, and it's got a really cool capability on there to smooth the skin. So I love that. And it has the ability to change the gene expression in the cells. So I just feel like it's a low downtime procedure. Most everyone outside of your fits 5s and 6s, but again, they do have hyperpigmentation. I lean towards more chemical peels for them. There's safe ways to use the BBL.
Mm-hmm.
I don't think that I'm the best person to
For our African,
that. It's just not, I don't treat enough skin of color to be really confident in treating somebody who's a very dark Fitzpatrick type. So I lean chemical peels for them. But for your fits 1 through 4, it's a really great just treatment that you can get done every single month, every 2 months, every quarter, and it will keep your skin functioning optimally, and you will look amazing. I mean, look at Dr. Bitters for crying out loud. I mean, that man looks 30 years younger, and he's done like 200 plus BBLs
to his face
only. Yes.
I agree. No, I agree with you. I think the study out of Stanford School of Medicine that showed the change in gene expression is amazing.
Making your cells function
younger,
healthy and younger
is crazy. Yeah. That's amazing. They literally took a biopsy and it showed that. And then also that study that we referenced about discoloration versus wrinkles. Mm-hmm. Other people picked the people with discoloration in terms of who looked older. Mm-hmm. So that's pretty crazy. I'm just ever since we brought on the Helix CO2 laser from Cartessa, I've just loved it so much for that. The ablation that it gives to the top layer of the skin, and then the deep dive with the 1570. It's so great for stimulating collagen as well. It's amazing for texture, tone, deep wrinkles, those barcode lines on the upper the upper lip.
Great laser.
So that was just, when I think of anti-aging, I think of CO2 and the insane things we can do with it. But if you're looking for an anti-aging laser that doesn't have a lot of downtime, BBL is great, or we can do something like a cool peel. But I love my CO2.
You do.
Well, my other one. So is that the end of yours?
Those are all mine.
Well, Sculptra.
Yeah.
But I put some form of filler too.
I know. So which one is it? No, pick right now. Pick Sculptra or pick HA.
Okay. For anti-aging, I pick Sculptra.
Okay.
Because it is stimulating new collagen. We lose 1% of collagen in our late 20s for forever. So if we do nothing to stimulate back that collagen, you don't ever get it back. True. You can't really eat it. I mean, eating solid sources of protein, keeping yourself healthy is going to also help you age, but stimulating back new collagen and elastin is exactly what Sculptra does. Think of it as a sports bra for your skin. Mm-hmm. It's going to improve your skin quality, which we know makes us look less old. And it just sort of keeps everything in place. I love it. I think it's great for these little kind of ripples in the skin, and great for long-term rejuvenation. So
yeah, I think it's a great treatment. I get this question a lot, which is, and I'll be interested to hear what you think about this. So if you have a patient or you're talking and you're going over all the treatments, why do you need lasers for collagen stimulation and Sculptra for collagen stimulation?
So why do you need both?
Yeah.
To be honest, I've seen the most success through multimodality approach. Lasers are going to resurface the top layer of our skin, sort of like retinoids do, mm-hmm. and they're going to do a lot of dermal remodeling and sort of recoiling.
Okay.
Sculptra is going to create an immune response to stimulate collagen and elastin.
I think it's a great
That would
answer.
be my answer.
Yeah.
I don't know what answer you were looking for.
No, I was genuinely curious because I've had that question come up a couple of times because we constantly are talking about this collagen that we're losing,
Yeah,
this elastin. I think it's when glycation happens, it's really difficult to undo, which is, a lot of that sugar and that really thickened skin. But that's a loss of collagen and elastin. So once you get to that point, it's hard to undo. So I'm like constantly just trying to pick everything to replace it. But that's a great explanation. Yes. That you just need both.
You need both. Like if I'm building out a treatment plan, and also for my patients whose priority is perioral, and they have these deep perioral lines, I really don't put a lot of Sculptra, maybe some hyperdilute radius there. So I think that the CO2 is fantastic for that. And then if they just have this layer that I need to remove,
right?
And maybe they can't tolerate a tretinoin, so I'm using a CO2.
Yeah, I think that's a great answer. Those are 5 really good anti-aging treatments. If you pick a couple of those, you'll be doing, I think, really, really good. If you pick all 5, you're doing the most. You're a star student.
But also, like, something to note is that I feel like the Karen down the road sees anti-aging or aesthetic medicine as very vain.
Yeah.
And here is what I have to say about that. If you are someone who does sunscreen every day, you use a retinoid, and you wear a hat and you do a little bit of Botox, you are still going to look and age better than the person who doesn't. And so you don't have to do all of these things. I don't think that anti-aging is a vain thing to do. I think it's just like going to the gym, but for your face. I don't understand the disconnect between, oh, you get Botox, why do you care so much about how you look? But then you can go to the gym and be healthy in that way.
It's psychological too. I mean, there are studies out there that show when you perceive yourself to look a certain way, you feel better mentally. I mean, Botox had a study on that, decreasing depression, but just overall, like, I have 80-year-old patients who don't want to look like they're 40, and newsflash, I can't do that. But they want to feel good. They're out walking with their friends. They're playing at their retirement home. They're doing all of these things.
Playing at their retirement home.
I have one lady who gets dropped off by her retirement home.
I love that so much.
And she just wants to feel a little bit better.
I love that.
And that's going to be me.
Yeah, I think that's a very solid choice.
Yeah. So psychologically, choose your own journey and what's going to make you feel the best, and we'll stop shaming everybody for doing everything else that they want to do.
Exactly.
Okay, that's our top 5. Leave us your
we would love
maybe
that.
top 5, or maybe your number 1 anti-aging hack or treatment that you've done that you've loved, because we want to hear about it. Leave that for us in the comments. Make sure to follow us on Instagram.
We were going to do a product shout out for sunscreen because we wanted to.
We just talked about that.
Yeah, we did. So we're going to try to feature a product every now and again. And this episode we are featuring sunscreen.
Yes.
So you can find both Tone Smart by Skin Better and Color Science Flex.
And Revision and Teleshade.
Yes, and I don't know why I keep forgetting that one. All of those on Dewstate.com. And it'll be delivered right to your doorstep.
Yes. So check that website out. Grab your favorite sunscreen and let us know your favorite treatments in the comments. And we will see you guys in a couple weeks.
Great.